Doc, si Dr. Abiyasingi said nga na definitely we already have community transmission of Delta here. And Delta nga is already found in 7 out of 10 cases that they've tested. I'm wondering if these elements or these new variables were factored into the decision to go granular lockdowns, or this precedes or the decision to go granular precedes these new variables. In which case, do we need to impose a new set of policies or protocols with these variables in mind?
Well, the decision for the granular lockdowns were made within the context of Delta naman. So that was recognized as a factor. And I think that one of the biggest things talaga that was extensively discussed, again, very counterintuitive, di ba? Pero paano mo naman ipipilit yung ECQ kung wala nang sumusunod? Yun yung mahirap eh. Whether it's because people realize that they really have to go to work because they have no more source of livelihood and they're willing to take the risk to go out, yeah. Diba? Oo. So parang I think that what remains naman for the health sector to do is to figure out a smarter way to attack the problem. Hindi naman porket kailangan mong napako ang kalaban mo, parati na lang martilyo ang pampukpok, di ba? So may ibang paraan. So kailangan natin mag-isip ng ibang paraan para magawan pa rin natin ng solusyon yung problema. Hindi naman parating lockdown na lang ang problema. And then again, di ba, 1.5 years down the road, lockdowns worked at the start. Now parang we're thinking different sets of circumstances. There's really a huge economic need. But at the same time, there's also a need for helping our healthcare capacity to cope with the problem. So we have to really balance it and figure out what's the most effective approach, because it seems like ECQs at this point don't really work too well anymore.
Doctor, sabi naman nila kaya daw hindi nag-work yung ECQ kasi hindi naman daw matched by testing and contact tracing eh. Mahina daw yung capacities natin doon. Kaya and besides, it's a different ECQ from last year's ECQ, no? Talagang ang dami namang pinayagan ngayon eh. You have more transport, you have more businesses open, right. You have, binanggit nyo na nga na you have more airports. So hindi ba, so kaya yung ibang tao ngayon, sabi dapat yung tunay na ECQ subukan kahit a few, siguro 1 week or 2 weeks, tingnan na epekto.
Well, so babalik na naman tayo dun sa ano bang gusto nating ma-achieve with the community quarantine restrictions. Hindi nga ba mobility restriction basically ang hinahabol natin? And if you look at data, talagang walang masyadong impact yung ECQ. Yung mobility halos hindi gumalaw. So whatever it is we implement, whatever you want to call it, no, as long as there's mobility restriction, it will definitely impact on decreasing the number of cases. So I guess the point lang naman is we have to figure out a smarter way to get that done. If not by ECQ, then something has to happen, and I'm sure different approaches can be tried.
Well, of course, this granular lockdown approach shifts the responsibility over to the LGUs. No, do you think that it's something that's well within their control to actually exercise and implement? Are they really in a better position to do that?
Well, I can speak for my encounters with the NCR mayors because there have been opportunities for our team to work with the MMDA mayors and they understand the problem. I will have to say that they're really quite proactive. And if they understand how the disease gets transmitted, then I'm sure they have ways of making sure that they can target the problem and answer it. No? Siguro for me, yung shifting the responsibility to the LGUs will be a good match for the problem because they see what's happening on the ground. And I think yung role naman, at least ng DOH or ng health sector, is ipaintindi kung ano ba yung hinihingi para yung specifics na iintindihan nila ng maayos.